lateralis is going to be the lateral side of the leg, okay? And intermedius, you would think, would be right in the middle of the leg. So we can test our quadriceps there if we wanted to do that on that one. Okay, our infrapatella tendon, okay, is right below. So here's our patella. There's the inferior pole. Okay, right underneath that is our tendon. It obviously attaches right here to your tibial tuberosity. So that's going to be your patella tendon on that one. Okay. Medial aspect. Page. Medial meniscus. Okay, remember joint line? We talked about joint line. Okay, so my thumbs are in the joint line. Let me do it on this one so people can see. All right, since we're on the medial side. Thumbs are in the joint line. Medial meniscus is really the joint line itself. So you're just going to be palpating right through the medial meniscus right here. And remember, it's a horseshoe, so it goes all the way around the back. So when you palpate, you're going to palpate just all the way around the back. You should be able to push on the joint line, and it should have a little give when you're doing that, and it'll just push all the way around. You can go all the way to the back side of the medial meniscus back there. Okay, on that one. All right, your sartorius, your gracilis, and your semitendinosus. All right. Is right here. You can kind of feel the tendons back here, okay? So they're going to be right in all lines of sartorius, gracilis, okay? So right in this area is where we're looking for those right there. So if you feel a tendon, you're pretty much on them, on that one, okay? So that's that area right here, okay? So that's not too bad when we're talking about those. So kind of right there. Okay, everybody got that? Okay, good. Just making sure. Stop me if I'm going too fast, okay? If you want to make them pop out a little bit more, okay? If you go pull your leg in, all right, you can get them to pop by doing that. And then they kind of activate, and now you can feel that tendon really good right there and all the way back up, okay? All right, lateral aspect. Let me see this one now. Okay. Lateral aspect, we have lateral meniscus. So again, joint line, and we're just going to be poking right along the joint line all the way around for that lateral meniscus right there, okay? Lateral collateral ligament, okay? You have a ligament that runs basically from the femoral epicondyle down to the tibial plateau, okay? And it's right along here. You can really get it to stand out, okay? Cross your legs like you would, no, dude-wise. Very good. Sorry, all right? You can see his, you can actually see his, it actually pokes out right here. You can see this really good, so I think everybody should at least take a look at that. But there's a tight rope that will show up as soon as you do that, okay? All right, that's your LCL. That's your lateral collateral ligament right there. So that's a really good one that you can see right there. So good LCL. Good LCL. Okay, you can put it back down. All right. Biceps femoris. Okay. If you flex the knee. Okay. So if you have him again, if you go flex it, so pull back. Okay. Again, biceps femoris is that first tendon that pops out right back here. You can see that one pretty good too. Okay, on that one. All right. Relax. Iliotibial tract. Okay, the best way I'll tell you this: find the femoral head, and you're on the IT band, because that's where we're going to have our issue down on the knee. All right, is it's going to, the IT band runs basically the length hip all the way down lateral side, and then pretty much comes right below the fibular head, and we'll attach here. This is where we're going to have our IT problems, is right here on this fibular head. So if you're on the fibular head, you're on the IT track. So that's what I want right there, is if you're right there. Okay. And then posterior zone right here, we got a couple things which are back in here. All right, it's just popliteal fossa. So the soft portion right behind the knee is your popliteal fossa right there. Okay, so that soft spot right there. Okay, and then if you just come right below the popliteal fossa, you're now on the gastrocnemius. Okay, and that's the last one that you have to do on that side right there. Okay, and there are two heads, so either side of the gastrocnemius. All right, so popliteal fossa, gastrocnemius right there. Okay. Do you want me to go on a special test, or do you want to go ahead and try these first before we go on a special test? This was the soft tissue. This was all soft tissue.